Ready.
Awesome. You're just going to look right here at me.
Okay.
Cameras don't exist.
Okay.
Please say and spell your first and last name and your title.
Keith Miller, Keithmiller.
And what's your title?
I'm a trauma surgeon at University Hospital.
So I want to talk to you just a little bit about today. We're laying wreaths here just in memory of the survivors of the gun violence that we've had in this community lately. And I just want to kind of get, from your perspective, what are you seeing? What's going on? Tell us about it.
Well, I think, you all have done a great job covering it. It's been a tremendously heartbreaking year for our city, I think. And first of all, I'll just say it's an honor to be here. I mean, that's what this is about. It's a time of tremendous joy for a lot of people around the holidays, but it's also a time of tremendous pain. A lot of people have lost a lot, things that most of us can't imagine over the course of the last year, not just this year, but many years before this. And so, again, our message is that this is a public health issue. It needs to be treated that way. As far as the question of volume, I mean, this has been a problem in our city for a very long time. And I'm optimistic and now because I believe that there's been sort of a lot of energy and synergy as far as trying to address this issue in our community. So I'm hoping that 22 looks very different than this year, years prior, a decade prior, honestly.
One of the things that you may or may not have an answer to this, but one of the things that I'm personally kind of noticing is that we're seeing a lot of young people die, and a lot of what I fear is that we have young people that think they're going to live forever. So when they think about getting shot, or when they think about these things happening to them, they for me it's almost like they believe bullets will just go right through them. So from a surgeon's perspective, tell us exactly what do bullets really do to the human body? Talk to us as teenagers who say, look, if you get shot, you could die. I don't care if it's in your arm. I don't care if it's in your leg.
Yeah, I think, we think of gunshot wounds as penetrating injury, like a stab wound or a gunshot wound, but bullets crush. They crush through tissues, and they also cavitate. And so when I say cavitation, I mean tissues expand out and contract very quickly, so you can have a tremendous amount of tissue damage. I don't know, I think there is that element of invincibility that comes along with being in our teenage years and our early 20s. But we see a range of emotions after individuals are injured by gunfire. There's a lot of fear. I mean, I think it's very real. It's okay. No, you're fine. You see a wide range of the spectrum of human emotion after someone's injured by gunfire, and you see that fear. And so certainly, although that invincibility may apply to teenagers and young people in general, I think that goes away pretty quickly after being injured in a way like this.
And let's even talk about some of the survivors that are just victims of wounds, not just those that have been killed, but the survivors of wounds. What are some of the things that present trauma just for people just even getting shot or even hearing gunfire?
Well, yeah, so there's the physical injury component, there's the psychological component. Certainly everyone that's injured by gunfire probably takes an element of that with them the rest of their lives. The physical injuries, we talk about non-life-threatening firearm injuries, and I sort of hate that terminology because after being injured by a firearm, it can potentially be a threat to your life for the rest of your life. And I think we'll see injuries, spinal cord injuries, traumatic brain injuries. Certainly it impacts that individual, impacts that family, impacts the community in ways where may require constant care for the rest of their life. And at the end of the day, people say, well, that was a non-fatal firearm injury, so it's something less than particularly than a fatal injury might be. And in many ways, it changes the family dynamic in that individual's life in a very similar way. So yeah, I mean, the nature of these injuries run the spectrum, but at minimum, there's a psychological component that every patient that sustains a firearm injury probably deals with the rest of their life in some way.
Dr. Miller, for those who are thinking about committing a gun crime, for those who are carrying a weapon and thinking about pulling it and using it, explain to us what it's like to tell a parent, a loved one of someone who's been shot, that the victim of the gunshot wound has died.
I mean, you can't put it. You can't put that into words. I mean, it's heartbreaking. It's devastating. It's catastrophic. Whatever superlative you want to use. I mean, you know, I do feel like every time we do that, we lose some part of our own soul in some way, or whatever that is. It sounds, you know, corny, but it's catastrophic, heartbreaking. There are no words. There are no words. I can't give you an interview question or an answer that puts that in any way that anyone can understand what that's like for that family. And I don't go into sort of our emotion on the side because I think it's unfair, because it's not, you know, I mean, you're talking about families that are losing the most precious people in their lives. So I try to stay away from talking about how that impacts us or healthcare givers, because it's just not on the same spectrum that it is when you're talking about these families that have lost those they've loved.
Well, then let's just follow up with, what do you do to take care of yourselves as first responders, as people who do this horrendous work and who are doing it on a daily basis, sometimes 2 and 3 and 4 times a day?
That's a good question. I think we're in a better place there than we have been in a very long time. Where I think the first step is recognizing the impact of secondary trauma. You alluded to it before. I mean, from a community-wide perspective, and then I'll get back to your question, but from a community-wide perspective, you know, bullets don't have to hit anybody to cause significant damage. And that's another form of that secondary trauma that we're seeing from what our city is experiencing. Beyond that, from a healthcare provider perspective, I think, you know, recognition and saying that, yes, this is a problem, and taking it seriously, building those support groups within the hospital is important. I think we're beginning to do that, or we're progressing through building those teams to support each other. Certainly, there's an element of collegiality amongst all those that are taking care of patients that are not only injured by firearm, but across the spectrum of trauma, COVID pandemic, whatever it is. And so I think we're getting better at that. We're probably not where we need to be just yet, but I think that remains an evolution. At least recognition is happening now.
Thank you, Dr. Miller.
Those are all the questions I have.
Okay, I don't know that we answered the.
You did. No,
But
you did more than you did more than you know.
We appreciate you.
No, well.
Thank you so much.